masks as a measure against people who were infected but don't show symptoms passing on the virus. Is it possible that you would change your advice to the British public about wearing masks when they're out of doors? But first, if I may ask a question to the First Secretary, understanding that it's too early to consider relaxing any of the measures, could you share with us any of the specific ideas you're considering within government for how those measures might be relaxed when that time comes?
Well, I think it's far too early to talk about that. We're still, as Sir Patrick has explained, going through the peak. We are doing all of the work in government to assess the evidence. We'll be guided by the science and the medical advice that we get. And I think until you've got that evidence, we'd be getting ahead of ourselves. The focus right now, particularly after, I think, the relative success of encouraging people to stay home during the long bank holiday weekend, is to keep up that national effort, to keep the social distancing measures in place. And there will come a time in the future where we can talk about relaxation or transition, but we're not there now.
In answer to the question about masks, I'm going to answer first the question that you posed as if we saw new evidence, would we change our minds? To which the answer is definitely yes. That's what science does. It looks at new evidence, and we would give new advice if we saw new evidence. As you know, the WHO have stayed with their recommendation around masks. We look at this and update our view from time to time. We're actually looking at it again now. The evidence on masks is much more persuasive for masks stopping you giving it to somebody than it is for you preventing from you catching it. We are continuing to look at new evidence as it emerges, and if there's evidence that looks like we should change our advice, we would do so.
David, would you like to come back with a supplementary?
Yes, if I may, on the question of masks. I mean, clearly the growing scientific evidence about asymptomatic transmission, people having the virus without realizing it and passing it on, has convinced the Americans of the need to change policy. Might that happen here?
Well, as I said, it might do, because we're looking at evidence all the time. And of course, it's a complicated one because, yes, there do seem to be people who are asymptomatic or pre-symptomatic. By definition, of course, they're not also coughing and doing the things that can spread it. But this is all the data that we're looking at the moment. We have a review ongoing at the moment of the evidence around masks. And if that review concludes that the position should change, we will, of course, make that recommendation. And if it stays the same, we will make that clear as well.
Mark McQuillan from ITV.
Thank you. First Secretary, you've mentioned the lockdown measures are set to be extended. That's what you've indicated there. Why is there no clear plan as yet as to how we get back to normal once the lockdown is over? And also, why is there still no daily death toll for the number of people who are dying outside of hospital?
Well, I'll let Chris talk about how we're measuring the death toll and the different figures. We are working assiduously to make sure that we're ready when the right time comes. But at the moment, the evidence suggests that we're still going through the peak of this crisis, whether that's measured on the death count, the death toll, or some of the other measures that Sir Patrick has talked us through. It's absolutely crucially important that we do not take our eye off the ball or the public's focus on the thing that has been a success so far in relative terms, which is our ability through widespread support for our social distancing measures, to deprive this virus of the means to spread. It is critically important, and I think a lot of people listening to this at home would understand that as we're going through the peak of the crisis with the death toll at the level that it's at and increasing, we're absolutely keen to make sure, absolutely determined to keep our eye on the ball and our focus on what will save lives, which is people staying at home and protecting the NHS in that way. I don't know, Chris, whether you want to say anything further, or Patrick, on the point about social care homes and NHS deaths.
Well, so in terms of death, so the question was why are we not measuring death toll outside hospitals? And the answer is we are. So there are two separate bits of information that come out, but they come out at different times. The first, which is what we show here and can update on a daily basis, is deaths in hospital. And we're able to get those data relatively fast, and they're proven cases. We know that they actually have COVID-19 from testing. And then the second area of data, which is usually delayed by some days, trying to shorten that period, is the ONS data. And that covers all the people who have COVID as a diagnosis on their death certificate, irrespective of where they have actually sadly died. And those data do include deaths at home, deaths from care homes, deaths in other areas, where the doctor who has seen them thinks that COVID is or is likely to be the cause of death or an important contributor to the cause of death. So those are the two main ways that we're measuring them at the moment.
Mark, would you like to come back on any of that?
Well, I was going to just mention on the deaths outside hospitals, you mentioned the ways that they're being calculated. Will that information be, part of the figures that are released to the public? Is there any plan to release that information?
ONS data is completely open to the public and always will be. And I think that the other thing which it is important that in every situation we look at is not just the COVID direct deaths, but the all-cause mortality. So because some of the way in which COVID is going to be causing death, sadly, is obviously direct from the virus, and some of it potentially is from other causes, which include things like people not being able to get into hospital, which is at the moment, the hospitals are operating very effectively below their ceiling in terms of emergency care, but also things that might be postponed, and also the long-term effects of the economic and other effects on people's long-term health.
Victoria McDonald from Channel 4.
Being properly recorded, that we may actually never know the true extent, where you might have people putting pneumonia when it is COVID-19. How can we overcome that? How will we ever see that true figure?
We didn't catch the first bit of it, but I think it was on how can we reliably track the sources of deaths from COVID-19, particularly outside the NHS. Chris, do you want to touch on that, or Patrick?
Well, sorry, more specifically, it was about the true numbers of deaths.
I'm afraid you cut out on us. I think we've got the question. Chris, would you like to?
I think that the most important number, in my view, actually over the epidemic as a whole, is going to be all-cause mortality. So that's deaths from any sort. And obviously, of that, some of them will have been diagnosed by their doctor as having COVID-19. Now, of the ones that are diagnosed as COVID-19, in hospital now, and increasingly it will be true in other settings, that will be based on testing. So over time, the accuracy of that will increase. Our view is at this point in time, most people who have the syndrome that looks like COVID probably do have COVID as a syndrome. Obviously, that wouldn't be so true if we're talking about the period when the flu season happens later in the year. So interpreting these data do become more difficult, but ramping up of testing, which is happening, will allow us to get greater accuracy on this over time.
Victoria, do you want to come back in? I'm not sure we've got a signal with you, but try again.
Yes. I hope you can hear me. I was very specifically talking about deaths in care homes, because there is some concern that, especially if a doctor can't get into that care home, that they are not being recorded properly.
Patrick, I don't know if you want to.
Well, I think this is one for Chris, actually.